Welcome to the Medication Administration Refresher course for Cheyenne Village staff and host home providers. I'm Carrie Chauvin. I am the Cheyenne Village Nursing Supervisor and the instructor for this course. The objectives for this course are to review the process for accurate administration of medications, proper documentation, and the proper techniques for specific routes of medication administration. This is a reminder you are already an active, listed, qualified medication administration person. The rationale for this course is as a refresher or a reminder. Very easy to get into a rut and forget proper techniques. Remember, there is no certification or license with the QMAP. You are listed with the state, but it is not a certification. You are not trained to make medical judgments, so you need to make sure you have specific guidelines for administering medications. The listed are the routes that you may administer medications. No finger sticks or injections of any kind per Cheyenne Village policy. And you must have an order from an authorized practitioner, a doctor, nurse practitioner, a dentist, a psychiatrist, etc. Brief recap of MAIN, which is the mistreatment, abuse, neglect, and exploitation of our clients. Cheyenne Village has a zero tolerance for all of the above, and you can see the definitions listed here. If you have any questions regarding MAIN or what may constitute a MAIN situation, simply call your team leader or the Cheyenne Village nurse. Now, you need to also be aware of misappropriation. That is taking meds, money, any kind of belonging that is not yours, that belongs to one of our clients. Misappropriation is essentially a fancy term for stealing. And we will not tolerate. If you suspect or you think something is going on that falls into the category of MAIN, please let your team leader know. If you're not comfortable going to them, always come to the nursing office. Couple of definitions very quickly. Administration is when you assist a person in taking a medication, whether that's you help them put it on their skin or swallow the pill or use their inhaler. You were physically helping them at some point or completely giving it to them. They may participate a little or not at all. This does include G-tube administration. Now, monitoring is when the client can participate to a larger degree. They can do most of the pieces, they just need some supervision and perhaps some cueing. So this is reminding them to take their medication, handing them the pill bottle or medicine card, or bringing them the medication reminder box, watching as the person pours their medication and takes it or uses their eye drops or inhaler, or and documenting, making sure it is written down that you watched the person, that they did do things accurate. If the client refuses to take their medication or starts to be unable to take their medications per the policy for for taking care of it, then you need to let the nursing supervisor and your team leader know so that can be reevaluated. Self-administration is what we do ourselves every day. We know what medications we need to take, when, and how to take them. And without prompting, we do so. Now, some of our clients can do the same thing. There's a specific process that they go through in order to be allowed to do this. And as the staff, or in rare occasions, host home provider, you are checking in with them to make sure that they are continuing to be safe in administering their own medications. Okay, we're going to go over the medication routes that you are approved to administer. I'm going to go through these fairly quickly because you should be familiar with them. All right, we've got oral, which is you take it in your mouth and you swallow it. Sublingual, you place the pill under the tongue and it is dissolved on the skin, inhaled into the lungs. A spray into the nose, drops in the eyes, ears, or a suppository inserted into the vagina or the rectum. Those medications that are placed in a specific location are deemed a local action medication. So, eye drops, ear drops, all vaginal medications, most rectal medications, your skin, etc. They are to work right where you put them. Pills, either oral or sublingual, on the other hand, get into the bloodstream and are distributed throughout the body. These medications are then considered systemic because they can work on the body as a whole, not just a specific target location. Okay, so the medication forms that you might see. First are what they consider solids, tablets or caplets, which are compressed powder, either in a round or oblong form. They may be scored, as you see in the top left picture, in order to be broken for ease of administration if the pill is too large, or for dosing purposes. Also, in the picture with the orange pills, that's an enteric coating. This is a coating to protect the stomach lining from the harshness of the powder medication. The semi-solid forms are usually contained in a gelatin container and can be liquid or powder. The powder forms can come in just a pure ground up powder, either a sprinkle or a spancel. And these are medicated balls of varying sizes that are placed into the gelatin container and for proper administration, and time releases usually has something to do with whichever form it takes. Suppositories are medication in a specific medium that holds its form, is moldable, but will melt with body temperature. So when they're placed in either the vagina or the rectum, the body heat melts it and the tissues then absorb the medication for distribution. Lozenges are a candy form. It's usually a sugar-based form to create a hard candy with the medication inside. And usually they work on the mouth and throat. They are sucked on to be dissolved. Now, for any of these medications, you may see next to the name XR, ER, SR, control CR, or LA. These medications are indicating that the medication is designed to act for 12 to 24 hours. They're specifically designed in the format in order to work longer. This reduces the number of times the medication has to be administered. Liquid forms, the biggest thing here you need to be aware of is your suspensions. This is a powder medication placed in a liquid, but it doesn't dissolve. The powder doesn't dissolve into the liquid. And so when the medication sets, if it's a suspension, then the powder will settle out of the liquid. So before administering it, you must shake it up vigorously a couple of times in order to evenly distribute the powder throughout the liquid. This ensures that you're getting the accurate dose when you pour it. Now, when you do pour medications of any kind, make sure you pour away from the label. This will prevent any possible drips from getting onto the label and potentially obscuring it and making it irreadable. Your topical forms are your creams and lotions. They can be in water or oil base, and they can be thick, in which they're creams, or thinner, and they're lotions. Ointments are an oil or petroleum base with medication in it, and it is designed not to be absorbed. Creams and lotions can be absorbed into the skin, but petroleum or oil-based products don't absorb into the skin. So, for example, something like Neosporin, there's medication in it, it's an ointment, and it's designed to put over an open area, make sure the medication stays where it's applied, and protect the open area from anything getting inside of it. Now, on your patches, there are two forms. One in which the adhesive covers the entire part of the patch, and the medication is infused into the adhesive. So this means you have to be really careful when you're touching that adhesive on the patch, because you could absorb some of the medication. Gloves are best. The other is you may have a patch in which there's a medicated pad in the center and adhesive surrounding it. Okay. Your spray or aerosol medications. Aerosols are essentially medications that are under pressure, liquid or powder, and when the dispenser is pressed, pressure is released, and that forces the medication through the device. Sprays are more of a liquid in a bottle that is designed that when you press it, you squeeze the bottle, it forces the liquid out of the nozzle, and that process creates a spray. Inhalers are one means of aerosol medication. It is usually a powder under pressure, and when it's in its container and you press it, the medication is released. Afrin, on the other hand, is a nasal spray that is, you just squeeze the bottle and it disperses the medication. Right, dosages, you're not going to be very much involved in, of course, dosages. That's the physician, but you're going to have individuals who are on the same medication at different doses at different times, and that's because of this information. The physician, when they're writing an order, bases the dose on how much weight the person is. So, for example, the yellow box, this individual would need potentially more medication than this individual, just because of the weight changes. Age, younger people respond to medications in different ways than older people do, and the older you get, the body starts to, slow down, and so they don't handle medications as well. They don't eliminate it very well. So that can be a difference. Men and women handle medications differently. The particular diseases may dictate how the medication is dosed, how fast it works, how fast it's eliminated. If it builds up in fat tissue, okay, that means it's stored, so they may need less medication. All of these are factors that the doctors consider when they're writing how much medication they're going to give. All right, so what do we want meds to do? The intended action is what we want the medication to do, its effect. Now, it's not guaranteed. There's no way to predict if it's going to work or not work or only work partially. Medications usually have more than one effect. They are chemicals. And because of our different pieces, and they're starting to find genetics plays a part in this, medications can work better or worse on different individuals. So, the therapeutic effect is what we want to happen. Okay? This is what we want. So if we're giving an antihypertensive medication, then our therapeutic effect is the lowering of the blood pressure. All right. Now, a side effect is mild, it can be annoying, but it's tolerable. We can deal with it. Dry mouth, minor stomach upset, even occasional diarrhea, all can be a side effect, but we can cope with that. We can handle that to get the therapeutic effect of the medication. Adverse effects, on the other hand, are serious and can be life threatening. So, those are the ones we have to be more careful with. Anaphylactic shock is an adverse effect as well as an allergic reaction. Um, Severe liver damage or bleeding ulcers, these are more serious because they can require change of medication, um, additional treatment, even lifelong additional treatment. Now, we never or very rarely do we give one medication at a time. So when we put these chemicals called medications together, sometimes they work very well together and sometimes they don't. So for example, Percocet is Tylenol or acetaminophen with oxycodone. And when we put them together, they both work better. So the Tylenol or the acetaminophen enhances the action of the narcotic oxycodone. So these are two medications working together to be more effective. On the other hand, if you have an individual who's on birth control and then they take an antibiotic, the antibiotic breaks down the hormones in the birth control, making it less effective. So they work against each other. This is the reason why pharmacies and the nurses are looking at all of these medications, and some may be specifically scheduled in order to avoid these interactions. Now, you don't have to know all of the potential interactions. Just know that if we've scheduled something at a specific time, there could be a reason for that, and not to change that without consulting your nurse or a pharmacist. Two categories, prescription or non-prescription of medications. So prescription medications, as you're aware, are only obtainable by a physician. This includes controlled substances. They have a potential for abuse, side effects, or they're still looking at studies, research regarding that medication. Sometimes the reason it's medication is still only available through prescription is due to there may be only one version of that medication, or it doesn't lend itself to making it available. It's not safe to make it available for everybody to purchase. Non-prescription medications, or what we call over-the-counter medications, can be purchased freely from any store that has them in stock. But these medications, we tend to self-diagnose. Oh, my stomach's upset, and you go to the store and I'm going to get some Mylanta. Well, you've diagnosed yourself as having gastrointestinal distress, upset stomach, or nausea, and you have determined that you're going to prescribe for yourself Mylanta. And you tell yourself how much you're going to take, a couple of swallows, or you measure it precisely and take a tablespoon or 2 tablespoons, or the same goes for things like your Tylenols, your ibuprofens, your sinus congestion medications, cough drops. All of those, you are diagnosing yourself and prescribing the proper treatment. Well, for our clients, we can't do that. And so that's why we have to follow the directions that we do. Now, I talked briefly about controlled medications. Controlled medications are substances that have a high potential for addiction, dependence, abuse, and in some cases, a street value. There's a specific schedule to indicate where the medication falls on that list, from very, very mild, very low potential, to your street drugs like ecstasy or cocaine. Now, up through what they call Schedule 2 drugs, there is a medical reason to prescribe them. Others, such as cocaine or ecstasy, there's absolutely no medical rationale for them. So, those are your illegal drugs. They're controlled because of that abuse potential, because they're being misused. And so we have to follow specific processes per the government. That includes counting before distribution, verifying how much you get, keeping them stored in a locked container that is then stored in a locked drawer. They have to be double locked. Signing out every dose that is given. In addition to the EMAR, you'll get a count sheet from the pharmacy that indicates the name of the medication, as well as how many pills were dispensed. And every time a pill is removed from that container, whether it's a bottle or a medicine card, you have to sign it out and verify that the number of pills you have left is accurate. Okay? Because these are very easy to go into the wrong direction. Drug diversion. Okay? So if you're not paying attention, if you're not signing out and counting your controlled drugs, this is where the potential comes in. Drug diversion is when a medication, instead of the QMAP or RN giving it to the patient, they put it instead in their own pocket. Either they take it themselves or they take it to sell. Now, for some of our medications, we're going to see great impact on our client. We may see increased behaviors. We may see increased pain, or we may see increased seizure activity, depending on the medication that has been diverted. On the QMAP or RN side, what we might see are a whole range of behaviors, and you have to be aware of how that individual is normally. And most of us have seen somebody under the influence of alcohol, and in many cases it's the same way. They can be very moody, all of a sudden extremely elevated mood, or really depressed and withdrawn, very talkative, or completely silent. They can go either way. There are physical signs, things like excessive sweating, nervous movements, or dilated or pinpoint pupils, regardless of what the light in the room is doing. All dependent on the medication that they're taking. Okay? On the hand of if they're taking it for what they can get for it, for example, if they're selling it on, then what you're watching for is sudden expensive items, fancy jewelry, iPad or an iWatch, something that they've been wanting but couldn't afford, and now suddenly they have it. The consequences for drug diversion can be very serious. It is stealing from our clients, so there can be formal charges. You can be arrested. Certainly, you will be terminated in your employment, and you may face time in jail or large fines. Okay, so this is a very serious situation, and you need to be aware of it. If you've got a concern about somebody's behavior, or you're concerned about the potential of drug diversion, speak with your team lead or your nurse. Okay? And this is why the controlled drug count sheet is so important. If you sign out a medication and the count is wrong, then where did the medication go? Did somebody forget to chart? That happens. no big deal. Could it be that they said they gave it, but they didn't? Or they didn't give it, but it's also not in the bottle? So this is where your count comes in. If you check, you've signed out a medication and you count, you have too many or you have too few, there's a problem and you need to follow proper procedure in reporting it. Care of medications is how we take care of them. They do need to be stored and kept in a particular means. Internal meds are the ones we put into the body, or essentially you swallow. So those are your sublinguals and your pills. Your external medications are virtually everything else. Yes, including your vaginal and rectal medications. They are technically considered external medications. They have to be stored separately from your pills. If you have an eye drop and it breaks open and spills all over your medicine card, it can get into those pills, and most external medications are not designed to be ingested, not to be taken inside the body. And doing so can cause all kinds of problems and reactions. So we need to store them separately. Liquids, simply because they're large and bulky, are usually stored somewhere else, but it also helps save from spillage or making a mess. Wherever you store your medications has to be lockable. Now, most of our on-site locations, such as the group homes 183 or our apartment hubs, use a file cabinet that locks. In our host homes, you need to have a designated cabinet for which a lock is placed. And if you have controlled drugs, you need to have a secondary box inside that also locks. This is for the protection of our clients and to prevent drug diversion. Somebody getting into those and taking what they shouldn't. Okay. Now, disposal of medications. As you can see, the box in the middle picture, that is our drug box. It's in our medicine closet in the nursing office. That's where we take care of the medications. When it gets too full, we will follow the proper procedure, close it up, and send it off to the company, and they will dispose of it. Generally, they'll incinerate it. For narcotic medications, we use the drug buster, as you see there. It has an inert, safe liquid inside, but we pop and put the medications in that liquid and let it sit. It makes those pills irretrievable, so somebody can't pull them out and take them. And then they can be thrown away. If you have a medication that is changed in dosage, is discontinued by the physician, or you notice that the expiration date on it has passed so that the medication is expired, you need to bring it into the nursing office at Cheyenne Village and we will take care of it. Let us know what's going on with it. Doctor changed the order or you noticed it was expired. Bring it into us and we will dispose of it properly. Never ever flush any medications down the toilet. Okay, medication names. The names of medications, usually there are two of them. And that is, the first one is the generic. This is the name that everybody can use. Nobody owns it. It is derived from the chemical compounds that create the medication. It can be extremely difficult to say, which is why not many will use it. So things like acetaminophen, ibuprofen, diphenhydramine, those are the generic names of the medication ingredient in the pills. Now the trade or brand name is the name of the owner for the primary manufacturer. And that's the person who originally owns the patent on that medication is making the money on it. So for example, the company that makes Tylenol or Motrin or Benadryl. Those are the brand names for the generic names that I previously listed. Now, trade or brand names are usually a lot easier to say than the generic names, and so it's very easy for us, very common for us, to call medications, all the medication, by its brand name instead of the trade name. You know that every store out there that sells medication has a store brand, and it has some kind of, change of the name. So unless you actually buy the box that says Tylenol, you're not actually buying Tylenol, you're buying acetaminophen. Now the active ingredients are the same. It works just the same, but it's one company that makes Tylenol versus if you get the Walmart brand of acetaminophen. But Tylenol is easier to say than acetaminophen, so no matter where we buy it, or whether we get the cheaper store brand versus the brand name, we call it Tylenol. But be aware that there is a difference between the generic and the brand name. Depending on how the pharmacy is dispensing the medication, they may put the generic name on the bottle and we may put it in the EMAR just because that's how it was written or filled from the pharmacy, one way or another. If you're not sure what a medication is, you don't recognize it, there's a couple of ways you can look up that information. The first is in the EMAR. There's a link next to each listed drug for drug details. That provides you with the generic and the brand name, a picture of the pill or dropper or inhaler, and it gives you a list of the conditions for which that medication might be prescribed, common side effects, and a few other information pieces. So if you're not sure, that's the first place for you to look. The other option is there are two reliable websites that I recommend. One is drugs.com, and you can look up the medication, but the other nice thing about drugs.com is it has a pill identifier where you can put in the stamped imprint, number and letter on the pill, the color of the pill, and the shape, and it'll pull up pictures, and then you can compare whatever pill you have with that picture and identify it. This can be helpful if you find a stray pill in your medication drawer, knowing what it is and maybe where it got lost. Okay? The other is medscape.com. Both of the sites are very reliable and the information is trustable. Before you give anything to a client, you must have a physician's order. Now, this is very specific to if it can be considered a medication or medicated. So if you're in Walgreens and you're looking around and you want to get something for your client, for example, they've got dry skin. Well, if you get Lubriderm lotion for dry skin, there's nothing in there that can be considered a medication, so you're free to buy it and use it as you need it. On the other hand, if they have dry skin with itching and you want to get some hydrocortisone or something like that, it does have medication in it. You do have to get an order for it to be used. So this is where the line is drawn for this. So if you are not sure, check with your Cheyenne Village nurse. We will be more than happy to give you directions. Or if you need help getting orders for something, we will certainly be willing to help with that. Any herbal supplements are considered a medication and should have an order, all vitamins, and some creams, etc. So, again, only if it is non-medicated do you not need an order. And if you're not sure, always ask. Now, refills. as you guys know, most of our clients are getting their medications through Farm America, and at the end of every month, they deliver all of the medications to the Cheyenne Village office, and we, the nurses, audit them to verify that they are accurately filled and correct with the MAR. After which, those medications will be distributed to you for you to be able to have the supply to administer to our clients. For pills, this is a wonderful thing because um, it's precise. We know if they're on a once a day, we fill 30 pills. If it's a twice a day, it's 60 pills. So for pills, whether oral or sublingual, easy to be very precise. On the other hand, your creams, your inhalers, your eye and ear drops, anything else like that, could run out on an odd schedule. Many times these items, inhalers or liquid medications, eye or ear drops, are overfilled. So you may go past what you expect in their use. Creams are different because each individual who is administering a cream may determine that a thin layer is something different or the amount they use is a little bit different. That means that these are going to run out on odd schedules. Okay? So for those, you may have to call Pharmerica for their refill. And we recommend you call when you only have a 7 to 10 day supply left. If you call at 7 to 10 days, which is the earliest that the pharmacy, or rather the insurance, will approve a refill, it makes sure there's no gap in medication so that you can't give it because you don't have it. Because you don't have it means this is a med error. No supply, meaning you can't give it, is a med error. Okay? So when you're getting low, you need to call the pharmacy to get it refilled. If you can't get a hold of pharmacy or you're getting a runaround from the pharmacy, talk to your Cheyenne Village nurse so we can help you make sure there's no holes and errors. For some medications, that might not be a big deal, but there are a lot that we administer for which this is a huge problem, that we have to have the medications that they need. Okay? All the pharmacy provided medications. So here's the key. Pharmacy provided. So over-the-counter medication, something that you purchase, is going to be different. But every pharmacy-provided medication should have a label like this of some kind. It's going to have the information of the pharmacy itself, including a phone number, in case you need to get a hold of them because of a problem with the medication. A pharmacy-specific assigned prescription number. This is for tracking. The doctor who wrote the order and the day it was filled. Now, if you look at this label, there's no expiration date. Okay? And that's okay. Because the date it was filled is there, you can assume that this expires 1 year to the day from the date of filling. So, this bottle will expire August 31st, 2014. All right, so if there's no specific expiration date, look for the date it was filled and add a year. The patient's name is on there, and the name and strength of the medication is right here. And these are the instructions. How you take it, how much you take, and when you take it. Okay? And there's some extraneous information, how many pills were filled and how many refills are left. Now over here is what's called an auxiliary label. They're usually brightly colored. They may be small stickers added to this, depending on the situation. Your pregnancy warning is pretty standard. They come on most medications. But there may be a specific warning that is added. So for example, atorvastatin or Lipitor is rendered inactive by grapefruit. So this is warning people not to take grapefruit while you're on the medication. All right, so yes, our pharmacy puts their information a little bit different, but all of these components should be included. Weights and measures. Well, this is how we dispense particularly liquid medications. And household measures are teaspoons, tablespoons, and ounces. Now, in medicine, we actually prefer not to use these. You may still see them, but as you can see on these items, you're going to see the tablespoons or teaspoons as well as the metric measure here. And that's what we prefer is the metric. Okay? So the metric system. The reason we prefer this is it is more precise. Very easy to convert from one to the other. All right? So a gram is the base unit of measure of weight. We use milligrams, which if you have 1,000 of these little boxes here, 1,000 will fit in this big box, which is a 1 gram. Okay? And that's how it breaks down. It is very, very easy. Most common are milligram and milliliter, which are 1,000th portion of the base unit of liter or gram. Okay? Our medicine cups have metric milliliters. They will also have teaspoons, tablespoons, and over here is ounces on them. So you can, if you've got something written as teaspoons or tablespoons, it is on there as well as milliliters. Okay? Here are some abbreviations. You should be familiar with these. Most of the time, your pharmacy or the nurse is going to already convert the physician's order, including the abbreviations, and will spell it out on the MAR. So you may see some of these, particularly if you're reading a report or accompany our clients to the physician. But for the most part, the pharmacy or the nurses are going to translate these. This one is always a good one to know because it tells you if they have any drug allergies. So you can go through these. If you need a written list of these, that's fine. Contact me at the nursing office and I'll be more than happy to go through them. Let's see. There's one, EC. We talked about this earlier. Means enteric coated. Okay. That is a specific coating. It also indicates that that pill can't be crushed. All right. This is specifically coated in order to prevent damage to the stomach lining, and it is not meant to be crushed. So if you need it crushed, whatever medication it is, you need to talk to the doctor and the pharmacist to see if we can get another form of that medication. You may want to do a little bit of studying with this, as there are some abbreviations on the final. Calculations. We do have to go over a little bit of math because you, as the QMAP, are the final safety check before the patient gets the medication. You're the final step to make sure that the patient is getting the proper amount and safe amount of the medication that has been ordered. Okay? So, first of all, we have pharmacy is providing guaifenesin 400 milligrams in tablets. The doctor orders a dose of 1,200 milligrams. Well, we need to know how many tablets do we give. This is fairly basic, and if you've already answered 3, Good job. But here's how we found it, okay? So this is what the pharmacy has provided. So this is what we have. 400 milligrams of the medication in one tablet. This is what the doctor ordered. This is the dose that we are supposed to give. So another way this might be seen is this is what we're giving. Okay? And what we're giving is 1200 milligrams. So you can divide 1200 by 400 and you're going to get 3. Or you know that 4 times 3 is 12 and you add the zeros and there you go. If you multiply the top by something, you do have to multiply the bottom by that same number. So you carry it down. And that gives me that what we are giving is 3 tablets. Okay? So, liquids make things a little bit differently because we have, instead of a tablet, an additional measure. And so we're going to have to see how this is going to impact figuring out how much we're going to give. Okay? So, let's see if we can solve this one. So the pharmacy provides 20 milligrams in 1 ml. And we have to give, or the doctor ordered, 30 milligrams each time we give it. Okay? Well, we can divide this out, or you could cross multiply this. So what we don't know is what we consider X is the number of mLs 30 milligrams equals. Okay? Because this is how much we actually will give, is the measure of mils. Okay? So first thing we can do is cross multiply. And in this case, because it's only 1 ml, it's fairly easy. To do cross multiplication, we're going to set up the equation as equivalence. 20 milligrams over 1 ml, this is what the pharmacy have provided. And we need to make it equal 30 milligrams in X ml. Okay? Well, cross multiply means we do it this way. So 1 times 30 is 30 is equal to 20 times X is 20X. Okay? Well, now what do? Well, to do this, we divide it out. So 20 into 20 leaves us X, and then 20 milligrams into 30 gives us, well, let's see, 30 milligrams, 20. Okay, that goes in 1 time. That leaves me 10. So then what do? Put a decimal point and add a 0. And so then now we have 100. Well, how many times does 20 go into 100? 5. So X is 1.5, or we're going to give 1.5 mLs. Okay? Looking at this particular problem, you can also look at, we know that 20 goes into 30 once, and that will leave how much? 10. How much does 20 go into 10? Half. Okay, so you can look at it that way as well. Again, this is fairly simple because our measure of mLs is 1. That's not always going to be the case. In fact, it's not usually going to be the case. When you have a liquid medication, you're frequently going to see it in 5 mLs or 10 mLs per however many milligrams. Okay. All right, so let's try this. See, we've got a 5 mLs. This 5 is going to change things. Okay. So the pharmacy is providing amoxicillin 125 milligrams in 5 mLs. And the doctor wants us to give 500 milligrams per day. So how much do we give? So the pharmacy provides 125 milligrams in 5 mLs, and we're going to give 500 milligrams. So what we need is our unknown factor here is how many mLs equal 500 milligrams. So again, we can cross multiply this out. And I'm going to show you, this one actually does work out with two different ways easier. So we set our equation to each other. Okay. So cross multiply. We have 125x is equal to 5 times 5 is how much? 25. And we add the 2 zeros. All right. So these are bigger numbers. That's where it gets more difficult when you have a larger number here than 1. Okay. So what we're going to do is divide this. You divide both sides by 125. All right. Well, we know that 2 times 125 is 250, right? So 2 times 5 is 10. Carry the 1. 2 times 2 is 4 plus the 1 is 5. 2 times 1 is 2. So that gives us 0, and we draw down the other 0. Well, shoot, now what? Well, the answer for this is actually a little complicated, but what you do is you add a 0 there. And 0 times 125, you can add another decimal here and make sure you've got 3 places because your 125 is 3 places. So 0 times 5 is 0, 0 times 2 is 0, 0 times 1 is 0, leaving us nothing left to calculate and an answer of 20 milliliters. This is what we give, okay? All right, that's a little tricky. And the reason I'm showing you this and not saying, well, just grab your calculator, is because you're only going to have a couple of minutes. For the most part, you need to be able to do this quickly and in your head. You're not going to have time to pull out a calculator and figure out what you cross and what you don't cross. All right, so let's look at a little bit of an easier way. 125 milligrams and 5 mLs is equal to 500 milligrams, and we don't know how many mLs. Well, we do, but we're solving again. All right, so the easy answer is to look how many times does 125 go into 500. Okay, you divide that out, or you know that 125 times 2 is 250, right? We solved that over here. Well, 250 times 2 is equal to 500. Oh, I got my 500. 2 plus 2 is 4. So 4 times 125 equals 500. So 125 times 4 equals 500. If we do it to the top of the equation, we have to do the same thing to the bottom. So we take that times 4 and we bring it down here. And so 5 times 4 equals 20. There's your answer. So we're going to give 20 mLs, and that's going to give us the dose the doctor ordered. Okay? I hope that makes sense. If you're struggling with this, please give me a call in the nursing office. One last equation, because this one has a little bit of a trick in it. Okay, so for this particular problem, the pharmacy is providing cogentin 50 milligrams per tab, or in one tab, and the doctor orders 0.15 grams every day. How much do you give? Well, the reason this is tricky is because of the grams. Okay, 0.15 grams. Remember, grams is our base unit. It's bigger than milligrams, and we can't add these together because we have milligrams and grams, and that's essentially trying to add an apple to an orange. The math doesn't work. So the first thing we have to do is change the grams to milligrams, okay? Now, remember I said grams was your base unit, your 1, okay? We add a decimal point after it because that's where we put it when we have a whole number, right? Well, in the metric system, it increases or decreases by units of 10, okay? Now remember, I said before that a milligram is 1,000th of a gram, okay? So it's a 1,000th piece. So what we're going to do is if we're going smaller, which is towards the right, then we have decagrams, we have centigrams, which is 10 times 10, which is 100. Multiply it by another 10 and you get, milligrams. So what we do is we move this decimal point the 3 places we know to get it to the measure of milligrams. Okay, so, and since we do not often use the 10 or 100 in medications, if you're converting grams to milligrams, find where the decimal point is and you move it 3 places, okay? So, in this particular equation, there's our decimal point, all right? And we know this is grams, so put it up here. So what we have to do is move this decimal point 3 places to get milligrams. 1, 2, 3. Now, because after the decimal point are zeros, we can leave it off because we've got a whole number. But look at that, we've got an empty space there. What do we do with that? With empty spaces, you put in a 0, okay? So 0.15 grams is equal to 150 milligrams. Now we can figure out how many tablets we need to give to meet our dose, because now we have milligrams to milligrams and it all makes sense. So 50 milligrams in 1 tab is equal to 150 milligrams in X tabs. Okay, so 50 goes into 150 how many? 3 times. 3 times 5 is 15 and add the 0. All right, so if we do it to the top, we have to do it to the bottom. 3 times 1 is 3. So we are going to give 3 tabs to equal the dose the doctor ordered. Okay. Now, just briefly, if the doctor had written instead 15 grams instead of 0.15 grams, and we needed to change this to milligrams, how do we do it? So 15 is a whole number, so the decimal point comes after the number. Again, move it 3, 1, 2, 3, and you add your zeros in. So your 15 grams equals 15,000 milligrams. And this isn't a real dose unless you're talking probiotics, but you might see something like 1.5 grams, 2, 3 grams. There are a couple of medications that are dosed that large. Okay, and so 1.5, 1, 2, 3, 1500, 1, 2, 3, 2000, or, yep, 3000 milligrams. Okay, regardless of how it's set up, because you will sometimes have the pharmacy providing you with grams and you need to give in milligrams. You need to convert whichever grams to milligrams first. Then you can do your additional calculation in order to get to the proper numbers. Okay? Make sure this makes sense to you. If you're struggling with the math, and truthfully, we try to verify all of this way before it gets to you. But remember, you're the final safety check. You're the last person that's making sure that this is safe before it gets to our clients. All right? So make sure you know how to do this. Okay, infection control is a major consideration, and it's a new topic for the state as of last July in the change of regulation. Infection control is important because we're dealing with people. And with some of the medications, you're going to be dealing with body cavities or body fluids. So it's important you know how to protect the client and yourself. The number one way to prevent the spread of infection is hand washing, soap and water. Now, the water doesn't have to be hot. The soap doesn't have to be fancy antimicrobial, antibacterial. You simply need soap and water. All right. The biggest piece here is you want bubbles. Okay, and you only get bubbles if you rub your hands together and create friction. Okay, so you wet your hands, you put your soap on your hands, you rub the hands together to create bubbles and friction, and that helps get the soap under the bacteria or under the dirt so that when you rinse your hands, it washes away off your hands. Okay, so that's why you want to use soap and water. Always, always soap and water. If you're going to touch a client, between clients, always wash your hands. Okay? Now, hand sanitizer is a alcohol base that is designed to kill bacteria on your hands when they're not visibly soiled. Well, that's okay if you've simply handed somebody the medication, touched their shoulder, you touch the brush but not their hair kind of thing. If your hands are fairly clean and you haven't touched anything too involved, then yes, sanitizer is okay. You may use hand sanitizer up to 3 times before you have to wash your hands again. Hand sanitizer, at least in my opinion, does leave a film on your hands. I don't like it because it always makes my hands feel soiled. But you can use it in a pinch or if it's an appropriate situation. But after about 3 to 4 times, you want to wash your hands again. Okay? Now, personal protective equipment is barrier devices designed to protect you from blood or body fluids. And this is part of the universal precautions from OSHA. So, if you are going to touch blood or body fluids, or there is the potential that you are going to touch blood or body fluids, you put on gloves. They are one use, disposable only. If they get dirty, you take them off and put a new pair on. So specifically to medication administration. If you are putting in eye drops and there's eye drainage, and you need to clean off the eyes, put on gloves. Okay. Once you've cleaned the eyes, then you take those gloves are considered soiled. You take them off. You wash your hands. You put on new gloves. Okay. And then you put your medication in the eyes. If there's ear drainage, same process. If you're giving a suppository, vaginal or rectal, you put on gloves. If you're putting lotions or creams on, gloves, okay? And every time you take gloves off, you wash your hands, okay, before you put a new pair on. Okay? It's an extra precaution. Okay? Communication. This is another topic that the state decided was important to add to the QMAP education. And this is because it's very important how we're communicating with our clients. It has a lot of impact on whether they're agreeable or compliant with what we need them to do, whether it's give them medications or provide some other care to them. Basics of communication: word choice, tone of voice, body language. These are nonverbal. All impact how you approach a client. And these are only pieces of it. Part of communication, there's a message. Okay? There's the sender of the message. There's the receiver of the message. There's the means that you send the message. Your emails and text, those are means of communications, as well as actually talking to somebody, or even this, the video that you watch. Okay? The reason it's important is, and what we have to consider when we look at our clients, is their behaviors. Have they had bad experiences with people or the medical field, medications themselves? Do they feel out of control? Poor word choice. Depending on the situation that some of our clients have historically, a single word can set them off, trigger a bad memory. Now, you can't be expected to know where that potential is, but it's a good idea to kind of very consciously choose your words when you're talking to our clients. If you have mean or aggressive or condescending, impatient tone of voice, it's going to impact how our clients respond to you, agreeing or disagreeing or becoming aggressive or combative back. So, communication. The largest portion of communication comes from our body language. The second, from our tone of voice. Okay? Our nonverbal communication has the biggest impact on our clients or on each other. Okay? Our clients, even with, or maybe because of their disability, are very sensitive to body language and tone of voice. Okay? So, looking at things like, her arms are, she's blocking her face, her arms are crossed, her legs are crossed, she's all closed off. She doesn't want to talk. She's not receptive to anything you're saying. Okay? If he's wearing sunglasses, is he hiding something? He's got a smirk. If he's smirking at me, I may think I may interpret that to mean he thinks I'm stupid, or whatever I'm saying is no value. Hands in his pockets. He doesn't want to hang around. He's ready to go. Now, the receiver of the message of communication is the one who interprets that message. So, for the lady in the suit. Perhaps she has to go to the bathroom. And that's why she's kind of closing herself off. She's trying to hold herself together because I'm trying to talk to her, but she's got to go to the bathroom. And she doesn't feel she can excuse herself. My interpretation of what I see is that she doesn't want to talk to me. She's all closed off. Maybe she doesn't like what I'm saying. Maybe she doesn't like me or what I'm wearing. But my interpretation is that she does not open. She doesn't want to hear it. Okay. For this gentleman, if he's in a building and he's wearing his sunglasses, he's hiding something. My interpretation is he's hiding something. Now, perhaps it has to do with the lighting and he has an eye condition that he responds negatively to fluorescent lights, and so he's wearing prescription sunglasses in order to protect his eyes. As the person who is interpreting his body language, my interpretation is he may be hiding something. Okay, so it's whoever is looking at the person, it's the receiver who is making that interpretation, and it is that interpretation is affected by our past historical experiences or, random thoughts or a movie we watched. Okay, maybe you're a big fan of the Men in Black and he's got the aviator sunglasses on, and so that's, maybe he's a secret agent as opposed to he's hiding something. Okay, so it's based on you. It's based on what you experience and how you interpret what you see. Okay, so it's on our clients. We have to kind of think from their perspective. What do they see when they look at me? What message might I be conveying based on how I stand, how I'm holding my face? Now, not all of that's controllable, particularly your facial expressions. But if you think about how you communicate, what you might be saying, the better off you're going to be in working with our clients. All right, now we're going to get into the specifics of the giving of medications, the nitty-gritty. First of all, per the state, there are 7 rights of medication administration. The right person, the right medication, and this includes strength or the milligrams that are associated with that particular medication, the dosage, how much, how many pills, how many mLs, how many drops, the time. Now, this is going to be your daily, your twice daily. As a subset, it is the actual time on the clock. All right, but not specifically as part of the rights. Okay, the routes. We went over those in the beginning. You know what the routes you can administer. And of course, proper documentation. Now, refusal kind of permeates the whole thing, not one specific step, but you do have to be aware of the right of refusal. And I'll address that as we get into how you check your medications. So, basic process to start with for medication administration is currently we have electronic MARS and we have our medications. So you're going to be checking. So you have to have the computer in front of you and the medications itself. Bubble packs, bottles, drops, inhalers, anything that you're going to give at the time that you sit down to do this, you need to have with you next to the computer. The basic process, regardless of the route of medication, is right here, okay? So, you do your... Sorry about that. Let me get started again. You start right here. Your first check is using your 5 rights. So your first check is you use the 5 rights to check the EMAR and the med label. Okay? Verify that you have the right things in front of you. Then you prepare, client included. So if you don't have the client, you need to go get them. What else might you need before you administer this medications? Now, washing your hands can be done up here before you actually get started. Because if you got meds out, you don't want to step away and wash your hands at this point. So, do you need gloves? Are you giving eyes, ears, skin, suppository? Are you giving something that might need gloves? Do you need a tissue? Do they need water to swallow, or do they prefer something else? Okay. Now, some of this will change based on your location. So, for example, if you're with the Hancock team, you're taking the medications to their apartments. You're going to get the medication, or you're going to get the water or juice or tissues there. But you may need to take your gloves with you. These are the things you have to think about at this point in your process. If you have a situation where it's all together, you have a box of gloves there, you have a box of tissues, medicine cups, little water glasses, you're next to the refrigerator, or you keep water bottle with a client, whatever. All of those are going to factor into this, but this is where you prepare. You get your client and you get anything you might possibly need to administer the medications. Then you do your second check. Again, reviewing the first 5 rights between the EMAR and your med label. Okay? And as you do this, you pour your medications, your pills. If it's liquid, you set your drops aside. You've got them, depending on how many medications and what kind of medications you give, you prepare those medications to give. Once you've gone through your second check for all the medications that you need to give, you administer your medications. You give them to the client. Now, there is no specific directive as to what order you administer medications in. You can start with pills, or you can start with, for example, an inhaler. If you have a client who's on an inhaler, they're probably going to need to wash their mouth out. So you have them use the inhaler, then give their pills, and drink their water. Mouth is rinsed. Okay? Eye drops might be the last thing because they have to keep their eyes closed, or ear drops because they have to lay down in whatever position in order for you to give your ear drops. So there's no specific rule as to what medication goes first and what goes last. Give them in whatever order makes sense to you, and it'll be fine. Now, this is where the right to refuse comes in when you're trying to give the medication. If they refuse the medications, you can attempt to persuade them. Now, you don't want to spend a whole lot of time, but you know your clients, you know why they may be refusing, and how you can hopefully get them to agree to take their medications. Be reasonable. 5 minutes is acceptable. You don't want to be spending 10, 15, 20, 30 minutes, an hour trying to get them to take meds. Yes, it's important, but they do have the right to refuse. After that reasonable amount of time, if they continue to refuse, you accept the no. Okay, and then you're going to document their refusal. Then you do your third check, again, using the 5 rights, EMAR, and med label. And as you check each medication, you put it away. And then you document, give or not give, which we'll talk about in a little bit later. Okay? So, let's put the checks using the 5 rights into practice. So the first thing we're checking is the person, which at this point includes the name on the med label and the MAR or EMAR. So first of all, on the MAR or EMAR, you need to know where to find the name. In Therap on the EMAR, it's only at the top of the page. So you need to know you've picked the right one. Verify it with your first card. Okay? So I have Michael Mouse, and I have Michael Mouse. So I have verified in 3 points. You're going to need the actual person beginning no later than your second check to verify that you've got the right person. Now, you should be familiar with your clients, but if you're not going to say, "Are you Michael Mouse?" Because invariably somebody's either going to default to a yes or no, even if they're not. What you're going to ask is, "Can you tell me your name?" Oops. Or, "What's your name?" Depending on what you think might work best for your client, what they may respond best to. Okay, so now we have, that's person. All right, now we're going to look at the medication. Oh, I've got it. Okay. Medication name, strength, dose, route, and time. Okay, so first of all, we're going to look at medication name and strength. So the 10 milligrams is the strength of the medication, or in this case, 10 milliequivalents. So we're looking for potassium, 10 milliequivalents on the EMAR and on the medication bottle. So there it is, potassium chloride, 10 milliequivalents. Potassium chloride, 10 milliequivalents. This is your medication name and strength. All right. Then we look at the dose, the route, and the time, or what can be considered your instructions for that medication. Okay, so this is take 2 tablets. 2 tablets is your dosage. By mouth is your route, and daily is your time, and then we verify am I at the right time of day. I'm giving 8 o'clock medications. Okay, again, now we compare the MAR with the med label. Okay, and I've got take 2 tablets. I know PO is by mouth. So this is one place where you may see the abbreviations because of limited space on the label. And QAM, is that the same thing as daily? Yes. Okay. Even if it said QPM, this said daily and this was 8 p.m., that still matches. Okay, that's what we're looking for. We're making sure the pieces match. Okay, and these do. So that's my first check. Person, medication, dose, route, and time. And I can even do that all right here. Look, Michael Mouse. Potassium chloride extended release, 10 milliequivalents. Potassium chloride extended release, 10 milliequivalents. Take 2 tablets. Take 2 tablets by mouth. By mouth, daily. Everything matches. I'm good. Now, with PRN medications, in order to verify them, this is a little bit trickier because they're usually not going to have a pharmacy label. Well, I should say not PRN, but over the counter. This does include PRNs, but mostly we're talking about over the counter medications. I'll have to fix that. Over the counter. Okay, so as you can see, we've got calcium carbonate. And this is the physician's order. Calcium carbonate, and this is the strength of this tablet. So when I'm looking at the name, I need all of this to verify. Okay. Now it says take 1 tablet by mouth 2 times a day. And this is irrelevant. I had to trim it out. Okay. So that's the physician's order, but I don't have a pharmacy label. So what do I check? Well, on the manufacturer label, there's going to be a place that says directions. Should be in bold, and you're more than likely going to find it in fairly small print. But this is what you're looking for, is where it says directions. And that's what you read and compare with the physician's order. So, does the physician's order fall within the parameters of the directions on the bottle? If it does, it matches. If it doesn't, then it doesn't match and you can't give it. Okay? So, take 1 tablet by mouth 2 times a day. Does that fit within the directions on the bottle? And if so, then you can say it matches and you may administer it. If it doesn't, you cannot give it. You need to notify your nurse, and she will work to get a corrective order so that we can administer it as needed. Okay? All right. So, I'm going to touch briefly on the specifics for each individual route of medication, but I've gone over the basics, so this is just providing a little bit of additional detail. For pills, there should not be any real additional information you need to worry about. We try not to touch the pills themselves. You can use a medicine cup or bottle cap or something other. If you need to touch the pills, they do recommend gloves to administer. Watch to make sure that they swallow it. If the client is refusing their medications, you may not hide the medication in their food or drink without their knowledge. They have to be aware if you put it in food, if you put it in a drink, you have to let them know that what you're giving them has medication in it. All right? If you're giving PRNs, make sure you also go back 30 to 60 minutes and give us the results of that medication. Altering oral medications. Okay, we talked about the scored tablets in order to be broken. You may break a tablet if you need to because of its size. You're giving both halves, but the client can't swallow it whole because of its size. You may break it if it's allowed to be broken. Okay. If it's not scored so you can break it, you're going to have to talk to the nurse to see if we can get something changed so that it's in a size that they can swallow. Now, when we're talking about crushing a medication, this requires a specific order in order to crush medications. So if you're having a client who's having trouble swallowing pills whole, Even perhaps if you're breaking them or using food, please let the nurse know so that we can do the proper steps to get approval to crush their medications if that's appropriate. Now, when you crush a medication, in its powder form, all pills taste horrible. They're very, very bad. I've had some where they automatically try to make you gag because of the flavor. So we're going to put the powder in a food product. This is applesauce, and it's one of the most common food items that's used. Pudding and yogurt are two of the others. Now, the biggest thing with choosing a food item to put the medication is it needs to mask the taste. So you want something that's going to be a strong enough flavor to mask the taste. In my opinion, applesauce isn't. Unless the client just loves applesauce, I don't think it's strong enough to truly mask the taste. But that has been the default because it's easy to get. It doesn't require refrigeration. It's fine at room temperature. And most patients don't object to it. But I don't think the flavor is strong enough. Some puddings certainly will be strong enough, some will not. I don't think vanilla is. Strawberry, chocolate, butterscotch. I don't know what other pudding flavors are out there. But pudding in and of itself can be a strong enough flavor, unless it's bland like vanilla. If they have a favorite pudding that they like, certainly use that because then it's something they like. They're more than likely to eat it. Give them the whole container. Take a small amount to put their medications in. Give them their medications first, then give them the rest of the pudding. Nothing wrong with that. You make them happy. They're more likely to be compliant with what you need them to do. Flavor goes for the same for yogurt. So you want something that's going to be strong enough to mask the flavor. Some of the berries might be good. Lemon or lime, something like that. On the other hand, you can use peanut butter if the individual isn't allergic to peanuts. Peanut butter is a very strong flavor and so can be used to mask the taste. I had a nurse who used Hershey's chocolate syrup. She pour some in and she put the medications in and give it, and she never had anybody refuse her medications because the flavor was strong enough, and who doesn't like Hershey's chocolate syrup? For those who don't, and provided they're not diabetic, which is something you have to consider, you could use strawberry syrup or caramel. Okay. The idea is to put it in a food product that will mask the flavor and that the client is willing to take. So find what works best, and the nurses will support you. Okay, eye drops. If there is anything present in the eye, you do need gloves. If the eyes are clean and you're giving something, for example, for glaucoma, you don't necessarily need to wear gloves. You're going to be touching the skin under the eye, not the eye itself. Okay, so this is where you determine if it's necessary or not. You want to have them tilt their head back and have them look backwards to the best of their ability. Gently pull the eyelid down and expose the inside, and you're going to put the drops or the ointment in that pocket space. Never drop it directly on the eye itself. Never touch the tip of the applicator to the eye. It contaminates it. Once you've put the drops or the ointment in the eyes, have them close their eyes and keep them closed for a couple of minutes. This allows the medication to cover all of the surface it needs to. This is where you also provide a tissue. They have drips or excess medication, they can clean up their eyes for themselves. Ears. Okay. Again, you only need gloves if there is secretions or Some of our clients have problems with hygiene. So if their hair is not washed or their skin isn't washed, yeah, you can put on gloves. It's up to you to determine if they're necessary. You're going to have the client either lay down with the necessary ear up and exposed, or tilt their head to that side if they can maintain it for several minutes. You're going to grip the top of the ear, as you can see here, and you're going to pull up and back slightly. Okay, this straightens out the ear canal and makes it easier to get the medication where it's supposed to go. Now, you don't put the tip of the applicator in the ear itself. Again, you don't want to touch it to the skin or anything, it contaminates it. But you're going to position the ear appropriately for the drops to get where they need to go. Really important, this medication, ear medications, need to be at room temperature. Now, based on the medication itself, it may need to be refrigerated, which means you need to take it out at least 15 minutes before you're going to give it so that it warms up. If you pick it up and it still feels chilly, run it between your hands a couple of times. That'll help warm it up so that it is safe to administer. If you give an eardrop cold, it is going to be extremely painful for our clients, and it could cause some problems with dizziness. Once you administer the medication, they need to stay on that side for about 3 minutes. This allows the medication to get where it needs to go and not just run back out their ear. Nasal sprays. Again, gloves only if there's something present. Now, if there's no discharge, you still might want to, or they've got problems with congestion, you may want to have them gently blow their nose to clear out their nose and sinuses prior to administering. That makes sure that the medication gets to where it needs to go. If they are having a runny nose, definitely have them blow their nose, and yes, you will wear gloves. Once the client has blown their nose, you've disposed of the tissue, take your gloves off, wash your hands, again, put clean gloves on, because the potential is there may be more secretions. You're going to only insert the tip of the nozzle into the nose. You want to have them tilt their head slightly back, and you're going to aim the spray backwards. Okay? You are going to hold it with the 2 fingers on top, next on the flange, placed on the nozzle, and the thumb on the bottom, because you're going to press down with these 2 fingers and press up with these 2 fingers, which is going to disperse the medication into the nose. Now, when you're up here, you want to give instructions. Okay, things like, okay, I'm going to give you your nasal spray. When I say 3, I'm going to spray it. I need you to take a light sniff. And then on 3, 1, 2, 3, and give it. Because you can't, once you're spraying the medication, you can't tell them to do anything. They won't necessarily hear you. They'll be too involved in the medication that's suddenly in their nose. So give some instructions as you're preparing and getting things ready. Okay? Now, they do need to take a light sniff, but they don't need to try and inhale the medication into the brain. Okay? They don't need to take a deep, hard sniff of the nasal spray. Nasal medications are generally designed to affect the nasal sinuses, which are up here and under here. Okay, so they don't need to be taking a deep breath. Plus, if you've ever had to use any of the nasal spray medication, they don't taste very good. And if they take too deep of a sniff, they'll be tasting it. Okay, which may impact if they will agree to do it the next time. If they've been used to it at all, they should be fine, but please remember these things. Inhaled medications. Okay, these are the trickiest to administer to another person because you're coordinating depressing the inhaler with their taking a deep breath. Again, you're going to give instructions because once they take a deep breath, well, you're going to have to tell them to take a deep breath. They have to hold their breath for about 10 seconds to make sure the medication settles properly in their lungs. You want to make sure they're sitting as upright as possible. You're going to, again, thumb on the bottom, fingers on the top. You're going to press down with the top, up with the bottom, and that's going to dispense the medication. You're going to have them put their mouth around the mouthpiece. So what you're going to do is, your instructions are, okay, I want you to take a deep breath and exhale. Put your mouth around the mouthpiece, and on 3, you're going to take a deep breath. Okay, ready? Here we go. Deep breath, exhale. Here's the mouthpiece. 1, 2, 3. They inhale as you press the dispenser and hold their breath for 10 seconds. Then you wipe it off, do your checks, and put it away. Okay. Now, if the inhaler has a steroid in it, they have to rinse their mouth out. Now, it's hard to know if what medications do and don't have a steroid in it. So if you give them a sip of water or a little drink after everything, you're going to be better off. If they don't rinse their mouth out and they have an inhaler with a steroid, they could develop a fungal infection in their mouth and throat called thrush, and it makes swallowing extremely difficult. Okay. Also, just kind of back here, all inhalers, some need to be shaken. So it's okay if you shake all of them. It's not going to hurt anything because you may not know which ones specifically are required to be shaken. So you can shake them all. It's just easier and it doesn't hurt anything. Okay? Skin. All right, so first of all, we're looking at creams. Remember, because you are putting on a topical skin medication, you have skin too. So you must, this is the first place where you are absolutely required to put on gloves. This prevents you from absorbing some of the medication. Now, even for something that's not medicated, for example, Lubriderm lotion for dry skin, it's always better to put on gloves so that the patient gets the benefit in case they've got, flaky skin or may open their skin or whatever. It's just a means to protect yourself as well as the client. So anything that's topical, put on gloves. Depending on the area for which you have to put the medication, you may need privacy. If it goes on their legs or their arms, they may be fine just doing it right there. But if you have to expose them to any certain degree, use your best judgment. You're going to want to provide privacy. If they have to take clothes off for you to give that cream, take them to their bedroom in order to administer the medication. Now, you need to be careful as you're applying it. Not all medications have to be completely rubbed in. Some, you just apply a layer and then they are slowly absorbed. Okay? So what you want to do is figure out ahead of time, does it need to be rubbed in, or are you just applying a layer of medication? Once you take your gloves off, wash your hands, do your checks, put your stuff away, and then document. Okay, first we're going to look at rectal suppositories. Always provide privacy. If there is a concern, you can have a chaperone. Okay? Now, if you haven't administered too many rectal suppositories, it's uncomfortable and embarrassing for the client, but it's uncomfortable and embarrassing for you, the QMAP, as well. Unless you've done enough of them, you've gotten comfortable. This is an embarrassing process for everybody. So keep aware of that. and be appropriately professional. Okay, first of all, wash hands. You're going to put your gloves on as you're getting your medication ready. Now, positioning in this particular situation is important, and you're going to do that up here. So, in your preparation, positioning the client is part of that. You do want them to be laying on their left side. Their lower leg is straight and their upper leg is bent at the knee and the knee is resting forward on the bed. Once they're positioned, cover them with a sheet for their dignity. Then you get your suppository ready. Put on your gloves, you open the package, and you get a water-based lubricant like KY jelly. You can, if you need, get these little lubricant packets. They're very helpful. You want to be very generous with the lube that you're using. Using your non-dominant hand, you're going to touch the client. You're going to hold the suppository on your index finger of your dominant hand. And you want to make sure that you have lubricant on your tip of your finger as well as the suppository itself. Using your non-dominant hand, you're going to gently lift the upper cheek, and then you're going to start talking to the client. Let them know you're touching them. Tell them what you're doing so they are not surprised. Put a small amount of lubricant on the anus, and then gently start to insert your finger and the suppository. Make sure that the suppository is touching the wall of the rectum. If it's not, the medicine won't be absorbed. You may find stool in the rectum. That's normal. Okay? So you've got to make sure that the suppository is along the wall. Insert it gently. Push it with the tip of the finger until it's as high as you can get it. And then gently remove your finger. Now remember that hand is contaminated. Even if there's no visible stool on it, you just had it in their butt. You don't want to touch anything with it. But you need to hold their buttocks together for about a minute. Stimulation of the anal wall, the rectal wall and the anus can trigger the urge to poop. So we want to stop that so they don't lose the medication too quickly. We want to give it time to start to melt and to alleviate that stimulation. So gently hold the buttocks together for about a minute. Cover them up and dispose of your gloves and wash your hands. Now, depending on the kind of medication you gave, they can get up and get dressed and do whatever they need to do, or they can stay laying down. You're going to go back and double check everything and document. If ever you're trying to give a suppository and you've got questions or concerns, call the nurse. Vaginal suppositories. Again, provide privacy. Gentlemen, if you are having to administer a vaginal suppository and you're uncertain, you may certainly ask for a chaperone. If you're comfortable, that's fine. If the client requests, you may bring in a chaperone. Remember, the women are going to be uncomfortable with this, and so you need to maintain appropriate professionalism. Again, we're going to start off washing our hands ahead of time. You're going to prepare your medications. Get gloves. You're not going to put your gloves on until you're getting ready to administer them, okay? So part of your preparation is going to get the lube and gloves, okay? Now, timing-wise for vaginal medication is best to have immediately after the client's taken a shower or used the bathroom. And so then you get them laying down in the position as you can see, on their back, bare from the waist down, knees bent and spread, and feet flat on the bed. And then you cover them with a blanket. This can also be part of your preparation. Okay, so then you do your checks, and then put your gloves on, open the medication, apply lubricant, and then you go to your client. Bear them as much as you need in order to very clearly visualize what you need to do. Okay? Again, medication in your dominant hand, you're going to use your non-dominant hand to open the labia. Now, as you can see in the position in the picture, upper picture, the vagina is at a downward angle when a lady is laying on her back. So you need to be aware of this as you're inserting the suppository. These are also the wider suppositories because unlike the rectum, there's no sphincter you need to get through to hold things in. So apply the lube and gently insert the suppository and push it in with your finger as high as is comfortable for them. Okay? Gently remove your finger and you can release them. Have them put their legs down and cover them back up. Remove your gloves, wash your hands. Now, recommend that they lay down for about 5 minutes. And you can have them lay down while you're taking your gloves off, washing your hands, documenting if you need to. That way the body has started to melt the medication and is going to hold it in place even when they get up. Okay? And once you take your gloves off, you can assist them with getting up, getting dressed, or whatever else they need to do. Check to put the medication away and then document. Now, there is also vaginal creams that you may administer, and they are administered slightly different. Positioning is the same, and they do recommend, again, you cover their legs with a blanket until you're ready to actually insert the medication. So you put the tube of medication onto the provided applicator. Somewhere along the applicator it'll have a mark, or more than one, depending on how it is administered. And you squeeze the tube into the applicator, which also pushes the plunger back. Okay? So you fill it to the indicated mark that the doctor has ordered. They're laying on their back, legs, knees bent and wide, feet flat on the bed. Again, medication in your dominant hand, and you're going to use your non-dominant hand to open the labia so you can visualize what you're doing. Gently at a downward angle, insert the applicator as far as you can and still hold on to it. Then depress the plunger to expel the medication into the vagina. Gently remove the applicator and have them put their legs down and cover them up. Now, the applicator that comes in the box of medication is reusable until the tube of medication is empty. So, you're going to go in the bathroom, still with your gloves on, and clean off the applicator. Alright? Then I usually recommend you put it in a Ziploc bag with the medication for storage. Once the applicator is clean in storage, you may remove your gloves and wash your hands. By this point, the client can get dressed, get up, and go about their day. PRN, just as an information, PRN stands for Prore Nata. It's Latin, but it means just an as needed or as requested medication. Now, for PRN medications, you must have a specific individual indication. So, something that the client will tell you or you can see that meets the criteria for the medication. So, for example, if the client has a fever or comes up to you and complains of a headache, then you can give this medication. Okay? If this order said Tylenol 320 milligrams, give 2 tabs every 4 hours as needed, without this, you can't give it because that would be requiring you to make a medical judgment as to when that medication is needed. And per our discussion at the beginning of this class, you are not trained to make those determinations, not under the auspices of the QMAP. So if you have an order that doesn't have something like this for a PRN medication, talk to your nurse. She's the one who has to get that clarified for you. For every PRN, every PRN medication that you give, you have to go back and document results. A minimum of 30 minutes, but I would say usually an hour. Most medications are going to start working within 30 minutes, but you're going to see their effect after about an hour. Okay? If the client complains of something and you do not have an order to meet that need, you cannot give anything, even if it's a medication available over the counter. Call your nurse and she will work to get an order to cover that need. This is a photo of our electronic medication administration record. So here is where the individual's name will be. It's the only place it is on the EMR. So you need to check it before you start scrolling, because then you won't be able to see things. This should have a picture of our client. So this is another way to verify or identify who your client is. And this is some miscellaneous information here at the top. Okay. You can filter the medications by a time frame. So if the person has a lot of medication and you're trying to make sure you get all of their 8 o'clocks, you can filter it between 7 and 9, and that'll pull up all of those medications up to the top. That will allow you to not have to scroll through every single medication. TheraP defaults to an alphabetical order, irregardless of time. Okay? And here, so there's your person. There is your medication name and strength, your dose, your time, and route is over there. There it is here as well. Okay, so there's all the pieces that you need for your checks. Now, when you're documenting, you find the medication you need, you find the day. Okay, so we'll say today's the 11th, and you click in this green box, and it's going to put your initials in there. It'll change it to this amber from the legend above until you save it, and then it changes until this light green. Okay, so everything went normal. They took all their pills. There were no problems. You click in all your boxes and you click save at the bottom, and that saves all your documentation. Now, if, for example, the client on the 11th, since I put that in the 10th, he wouldn't take his medications, okay? That's a little different. You're going to go up here and you're going to click switch to detail mode. All of this changes to blues, okay? That's how you know it's different. So then you're going to click in your little box, and it's going to come with a pop-up box, okay? And the first thing is going to have a drop-down menu that has all of these options in it, okay? Here is your missed or refused, and in the bottom, it's going to have a comment box that you can type in. So tell me why. Why was it refused? Why was it missed? What happened? You do have a little bit of character limitation, so you don't want to write a book, but several quick words, enough to explain the situation, is what you need to do. Now, if the medication, so you're going to use this if it is not given or given at a different time. If you need to provide an explanation for anything, you need to use detail mode. Okay, you have leave of absence, which means they're not on your premises. This could be day program. This could be they're with family. Whatever is applicable, you put in their leave of absence and tell me where they are. If the medication is on hold due to the doctor or the nurse instructions, say that. It's on hold per doctor. It's on hold per nurse. Okay? And then you have your missed or refused. Those are the 3 that you're going to use under detail mode most often. You do not delete medications. This is an indication of this color. So that's why you know it's due. Okay? It changes to amber when you've put your initials in it, and the light green to show that it was administered. Okay? So that is the basics for the EMAR. If you have questions, call the nurse on how the EMAR works or something regarding that. Okay? This I just basically went over. On your controlled drugs, you're going to have a paper count sheet in addition to the electronic MAR. So you're going to have to chart in 2 places. Now, charting. When you give a medication, I prefer that you chart as soon as you can, as is here practical. So you have a time window for medication administration. This is 1 hour before to 1 hour after the clock time. So if it says 8 a.m. is your time to administer, you can give it between 7 and 9 a.m. and it is still considered on time. That is administration. Charting, on the other hand, is different. As soon as it is practical, after you've given a medication. So, for example, you're getting somebody up, you've done your checks and you've given the medication because they need to get to the bus to go to day program. So you help them grab their lunch, you walk them out to the bus. Okay? And then something comes up, you get a phone call. Once all of that's clear and time has settled, or situation and activity has settled, then it is practical to go back and chart. You do need to chart within the day meds are given. So each day you need to document that day's medication. Okay? And you only charted what you gave. All right? Do not chart for somebody else. That is considered fraud and it is punishable by the government. If you make an error, now this is a medication error. I'm sorry, not a medication error. If you make an error in charting. So, you were going through and you saw 8 and you clicked it and it's morning and that medication was for evening, but you already hit save, call the nurse or your team leads and we can administratively put in additional information. But this is a charting error. If you documented that you gave it but they had refused it or they are with family and you were hit the wrong day, anything like that, contact the nurse or the team lead so that we can make those changes. Talked about follow-up. Okay, if you have any questions about the EMAR or TheraP regarding charting, let me know. Medication errors are errors in administration. Okay, this is the 5 rights. An error makes these the 5 wrongs. So for example, you got the wrong patient, the wrong time, the wrong dose, the wrong route. Okay? Those are the medication errors. Okay? Number one cause of errors is distractions. Okay? You can also be tending to do too many things at once, or you get overconfident. Oh, I know what's going on. And instead of doing your checks, you just pop the medications without reading anything. There may be a dosage change, there may be a schedule change. You may have thought you grabbed Joan Smith's medications, but what you grabbed was Joanne Smollett's medications. Okay? All of those lead to errors. So, to minimize the risk or reduce, it's not possible to completely eliminate them. We are human, remember, no one's perfect. Okay? Do your checks. Follow the 5 rights. Verify your medications and your MARs. Eliminate your distractions. If you need to, tell your coworkers or whoever's in your home that you're trying to do medications and you need no distractions. You need no interruptions. If you need to, make sure your cabinet with your medications isn't in the kitchen. Kitchens is one of the busiest areas. Everybody's coming in to get a snack or drink or something. So put the medication somewhere where there won't be any distractions. Okay? Now, if an error happens, admit it. They happen. Everybody's human, nobody's perfect. They're going to happen. Even I have made med errors. Okay? You're going to notify your chain, so your team leader, the nurse, whoever else is required, and you're going to document, which for us, of course, means a GER. Now, depending on the type of error, you may need to document in a T-log if you're monitoring for anything, if you see any changes of condition. Okay? Your controlled med sheet, if the count is wrong, more or less, it counts as a med error and it has to be reported as such. Okay? So you need to be aware of the seriousness of medication errors. Clients have died because they've not gotten their medication. They've had serious life-altering effects when they've gotten the wrong dose. Okay? So, take care of our clients and be conscientious when you're getting a medication. Okay? By being mindful as you go through the process of pulling your medications all the way to the point where you actually give them, you will reduce your med errors and you are actually taking care of that client. Okay? Emergencies. Fire, flood, snow, blizzards. These are large emergencies. You need to be aware that if you have a situation, fire or flood, that you may have to evacuate, you need a plan regarding medications. It's important to have, either a list or, okay, if I have to get out, what do I grab? Where is a duffel bag? Where are the medications? I need ID. What about cash? Is there something that you need to grab as you're running out the house? Not just for yourself, but for the clients as well. Okay? You don't know when you're going to be going back into that house. You don't, or apartment or location. You don't know if anything will be permanently damaged. And our clients still need to be taken care of. And considering some of the medications they're on, these are major things to consider. So, figure out a plan. You don't have to necessarily have a go bag. If you watch Criminal Minds, they always have a go bag. It's packed with clothes and whatever essentials you might need to leave on a moment's notice. No, but you need to have a clear plan that everybody understands what they're going to do and what they're going to grab if you have to get out of your house in a hurry. Okay? And that does include our clients' medications. Now, on a smaller scale, uh, similar medication names, you can, if you switch them or give improper doses, give the dose for the Toprol for the Tegretol or vice versa, this can constitute an emergency depending on the medications involved. Be aware of if you have any similar um, medication names, and you can use different things. If you have any questions, call the nurses to help indicate which one's which and how they're separate and when one is, and to differentiate between the two so they don't get confused. Choking is considered an emergency. Um, all of our staff, host home providers, should be CPR certified, including choking protocols. If you have any questions, you can always call me. I will be the instructor for CPR and first aid going forward. And I'd be more than happy to help you if you're not sure of what the process is. For many of our clients, they may not be able to use this universal sign for choking. You may have to watch for other signs. This is where knowing your clients is very beneficial. Know they're normal so that you can pick up on when things change. Seizures is the other emergency under the consideration of the regulation. Now, we have a number of clients who have seizure disorder. They have a protocol that tells you what you're supposed to do. But anybody can have a seizure triggered by a number of factors. High temperature, medication changes, trauma. They've bumped their head hard enough, depending on where and how. All of those might trigger a seizure. So if you're not sure how to handle that, which is part of your first aid training with your CPR, call the nurse to make sure that you're aware of that. The basics are you want to make sure they're safe. If they've been standing, make sure you lower them to the ground. Loosen clothing, turn them on their side. Remove obstacles that they may bang themselves against so that they don't hurt themselves. Never insert anything into the mouth. And you want to note the time the seizure started and the time it stops. If it goes longer than 5 minutes, you call 911, particularly in an individual who's never had seizures before. If within 5 minutes it stops, you're still going to call 911 for somebody who's never had a seizure before so that they can get checked out and find the cause of the seizure. Any questions? Check with a CV nurse. So, some basic do's and don'ts. You do want to keep a clean work area wherever you're pulling your medications. They need to be kept in a locked container, separate internal from external. Make sure you're doing your checks. If you have questions, call. If there is a change in the appearance or odor of any medication, whether that's a pill or a liquid or a drop, you're not going to give it and you're going to notify the pharmacy or the nursing office. We like to foster independence in our clients, so allow them to help with their medications wherever they're possible. Ensure the medications are swallowed, document and report any errors. Don'ts are essentially the opposites of your do's. So you don't leave your medications out and open. You don't use a medication if it's improperly labeled. You don't relabel a medication. Never ever borrow medication from a client. You have to have an order. Do not delay in documenting. As soon as you can after the administration of medication, sit down and document. Never assume the label is correct. Pharmacy, the techs, the pharmacist, they're human. They make errors as well, so always double check. We never give meds to somebody who's unconscious or actively vomiting, and we don't give dropped medications. Never deny medication error. Report it, okay? Yes, we may take some steps. You may have to listen to this presentation again or come to my class. But medication errors happen for reasons. We need to know why and see what we can do to prevent it. Plus, we need to monitor the client to make sure that they don't have any serious side effects or impact from the medication error. We never pre-pour medications. This leads to errors. Never ever chart for somebody else, only yourself. And never forget you're part of a team and ask for help if you need it. All right, medication reminder boxes. I know some of our apartment clients use these, not so much in our host homes. It's a compartmental device filled with pills that are specifically assigned a time, always the same time. And you can have different kinds as you see in these pictures. Unless you are a designated qualified manager, you may not fill any of these medication reminder boxes. You may give meds from one, but you may not fill them. We only ever fill a 2-week supply at once. There is a label on it that shows what medication, dose, how many pills are in each box, and the time for administration. PRNs may not be placed in these boxes because those you never know when or when the client may need that medication. You may not put any medications that have special instructions with meals, with food, that kind of thing. It has to be strictly time designated, 8 a.m., 9 p.m., etc. Medication reminder boxes can be filled by the client who's been observed and trained, the qualified manager, who are our team leaders and usually another designated, either the QC or the SC, the nurse, or a pharmacist may fill them. Only fill for a 2-week period of time, and there is specific forms that we use. We talked about the label. If you were administering medications from a medication reminder box and you find an extra tablet in the compartment, stop. You're going to have to send that back to whoever filled it, and it'll have to be restarted. If you are missing a pill, same thing. Just don't administer it. Go back, take it back to the office, and talk to your team lead to look at it and refill it from that point. Now, you may need to dispense medications from their bubble packs for that one time period while your team leader is fixing the medication administration box. Okay, but once it's refilled, you can use it going forward. A qualified manager for us is a designated individual by Cheyenne Village who may fill the medication reminder boxes beyond the nurses. And for us, that's the team leads and another designated member of their team. Some client-specific requirements. They have to know quite a bit before they are allowed to administer themselves medications, even from a medication reminder box. They have to know what they take, when they take it, how they take it, what the medications are for, and be able to document. Once we've followed the process to ensure all of these steps, then the client can administer their own medications. Okay, psychotropic medications are a very serious category of medications. They are designed to modify or change a client's mental activity, thoughts, or behaviors. And as you know, many of our clients are on at least one, if not more, psychotropic medications. They have to be seen by a psychiatrist at minimum of every year or reevaluated by an interdisciplinary team to determine if those medications are still appropriate. Every client should be on the minimum dose possible to effect the necessary change or to be effective. And the psychiatrist works into the plan the potential for reduction and discontinuing the medication. Now, they may try to reduce a medication dosage and it fails. That's okay as long as they're making the attempt. Psychotropic medications have very serious side effects, which I'll go over in a minute specifically, that you need to be watching for. And if you are watching for behaviors, they should have a ISSP. If they don't and you have concerns, speak with your team leader. Psychotropic medications cannot be PRN. No exceptions. So some of the common psychotropic medications that you may see are antipsychotics, which are given for thought process or psychotic symptoms, antidepressants, which are for clinical depressions diagnosed by a psychiatrist, mood stabilizers, things like bipolar disorder, or anti-anxiety for anxiety and or panic disorders. All right, so the side effects. These are side effects that you need to notify the nurse immediately if you see, because they can have long-term consequences. Extrapyramidal symptoms, also known as EPS. You may see tremor, rigidity, stiffness, restlessness, increased fatigue, or continual movements, particularly if they can't control them. Tardive dyskinesia is involuntary and they're rhythmic movements, face, mouth, and sometimes the extremities. They are often unaware that they're doing the movements. If they think about it or they're trying to do something else, the movements stop. But the minute they are not focusing on their face or the mouth or wherever the movement is, it returns. Jaundice or yellow discoloration of the skin indicates liver damage. Now, up to a certain point, jaundice is treatable and the liver damage is reversible. But there becomes a point when it is permanent and the only treatment is a transplant. Neuroleptic malignant syndrome is a life-threatening emergency. This is a sudden high temperature, difficulty breathing, profuse sweating, and this is where seizures may be triggered. You may have altered consciousness. For example, they may lose consciousness, or they may seem dazed or confused, and you may see tremors. If you see a sudden jump in temperature, I mean from normal to like 105 or even higher, like 108, you need to immediately call 911. Let them know what's going on, and once they've arrived and started to take care of the client, then you can notify your Cheyenne Village team leader and nurse. Psychotropic medications are not to be stopped all of a sudden, and this is the crucial piece with your refills. You must make sure there are no holes. Even missing a single dose for somebody on an antipsychotic or an anti-seizure medication can increase or trigger side effects or behaviors. Okay? If you see any of the side effects, we call 911. Now I have a video here that's going to show you some of the movements with tardive dyskinesia. It's late onset, so they've been on the medication for years. It is irreversible. Chorea means movement. Dystonia is the muscle tone. This is Dorothy. She was on a medication and she started having the side effects. At the time, her psychosis was completely controlled, but she had the muscle movements of the side effects. You can see the twitches in her arms and her shoulders, her head off to the side. When she stands, she's leaning backwards. And that arm movement is, see, when she intends to point, it stops, but she's not. It just flaps around, and she's got a leaning backwards posture that she can't control. She can't stand straight up. Okay, these are some of the side effects that you may see. When she thinks about it, she can control her limbs, particularly that left arm that was moving. But you can see she's still got some twitches and stuff. All right. Seizure medication, or what's considered anticonvulsant medications, helps to reduce or control, but not eliminate, seizure disorders. It's not possible to completely eliminate seizures. What we are trying to do with medication is raise the seizure trigger threshold so that the electric activity in the brain doesn't reach that trigger and thus prolong the time between incidences of seizures. Some of the adverse side effects with this medications are jaundice, again, liver damage, toxic levels of the medication, which can cause problems, or a skin rash. Again, we do not stop this medication without direct indication from the provider. So making sure we have adequate supply is important. So here's some jaundice. Now, as you can see in this picture here, it's almost impossible to tell that he's got a yellow discoloration in his skin, but in his eyes, it is very clear. In this gentleman, his dark skin tone is masking, as well as in this gentleman, is masking the discoloration in the skin, although the light is shining in just a way you can see some in his nose. But it's very clear in the whites of the eyes. Now in the bottom right hand picture, if you saw this gentleman all by himself, his skin tone may not appear to be abnormal or yellowish. It is only in comparison that you can see the yellow discoloration. Okay, the whites of the eyes are the number one place to see the jaundice discoloration. Hormone medications or hormones are naturally occurring in a body, and synthetic are used to replace, alter, or support a body function. Estrogen, progesterone, testosterone are the sex hormones. We frequently provide ladies after menopause with Premarin, which is an estrogen. And you'll give Synthroid, which is a thyroid medication for hypothyroidism or low thyroid stimulation. There are naturally occurring steroids, but we also use artificial or medication steroids in order to treat various conditions of the body. There are also growth hormones that help support normal growth. Herbal medications. Now, this is a little bit of a tricky category. Natural supplements, things like glucosamine or echinacea, these are herbal supplements, but they are not controlled or approved by the FDA. As such, there's no regulation on the processing, on the concentration, on growth of anything regarding these substances. Because of that, they may have some serious side effects, including toxicity. So, for any of these medications, of course, they must have a doctor's orders, and we never recommend them to a client. If family requests them or the individual thinks they'll be of benefit, they may ask for them, but we do not recommend or encourage them in any way, shape, or form. This piece right here is a major issue. The concentration may not be the same in the growth of the organism or plant that results in the medication. For example, echinacea is a plant. They may use pesticides or dangerous fertilizers in order to increase growth. Because of that, they are not necessarily safe, and so we do not encourage or recommend them. All right, There's all there is. You finished the QMAP Refresher course. Congratulations. Thanks for listening. Sorry for the little blips. If you have you will have an opportunity to complete an evaluation. If you have any feedback, I'd very much like to hear it. Good luck.